On behalf of NIOSH, welcome to the first installment of the 2024 Expanding Research Partnerships webinar series. The series theme is exploring worker safety and health in unique environments and challenging working conditions. Today's webinar will focus on protecting wildland firefighter safety and health. Now, it is my pleasure to introduce Dr. Jessica Streit, Deputy Director of the NIOSH Office of Research Integration.
Thank you, Nicole, and thank you everyone for joining us for today's webinar. We wish you a happy Valentine's Day, and we appreciate that you're spending part of it with us. We are honored to bring together experts from the occupational safety and health community to provide critical insights into successes, challenges, gaps, and needs related to the protection of wildland firefighters. It is my pleasure to kick off our event by introducing our distinguished panel of speakers. Kat DuBose is coordinator of the Wildland Firefighter Health and Wellbeing Program in the Office of Wildland Fire in the U.S. Department of the Interior. She previously worked for the U.S. Forest Service and NIOSH, conducting wildland firefighter health and smoke research, and she also spent the 2019 fire season as a crew member on an elite team of highly trained wildland firefighters. Her time spent as a researcher and wildland firefighter allowed her to obtain high-quality personal and area exposure data and understand risks in the complex fire work environment. Kenny Fent is a research industrial hygienist and currently leads the National Firefighter Registry, or NFR, for cancer at NIOSH. He has spent 15 years studying firefighters' exposures and health effects and has published over 80 scientific articles and reports that provide evidence to support a variety of control measures to reduce carcinogenic exposures in the fire service. Dr. Fent actively serves on several first responder health and safety committees and advisory boards, and he is also a commander in the U.S. Public Health Service. Rick Swan has spent over 40 years in the fire service and firefighter health and safety. He devoted 33 years of his career to CAL FIRE, retiring as deputy chief. He has also spent 7 years with the International Association of Firefighters as the Director of Health and Safety Operational Services, and he now works as an independent consultant for Wildland, Urban Interface, and Firefighter Health and Safety. Rick has a passion for firefighter safety and spent over 20 years on National Fire Protection Agency and International Organization for Standardization committees. And finally, Jay Tarley is the team lead for the post-market personal protective equipment, or PPE, testing team in the National Personal Protective Technology Laboratory at NIOSH. For over 14 years, he also served as an investigator with the NIOSH Firefighter Fatality Investigation and Prevention Program and conducted more than 100 fire investigations. For the past 10 years, his research portfolio has focused on cancer in the fire service and the cleaning efficiency of firefighter PPE. And now we're ready to begin our webinar. Approximately 40 minutes of presentation from our speakers will be followed by an interactive question and answer session. Please put your questions in the Q&A box at any time during the webinar. And without further delay, I'd like to invite our first speaker, Kat, to our virtual podium. Kat?
Good morning. I'm just going to assume that folks can hear me. I just wanted to come on and talk today about the research that I've done, the work that we're currently doing here within the federal land agencies, and also just some experiences of lessons learned of doing research in this incredibly dynamic environment. So just wanted to start off by giving folks an intro to wildland firefighting and what a day looks like. So every day, typically, we'll start with getting out to your workspace. If you're on an engine, you're driving an engine out there. If you're on a hand crew like this crew is, you're often hiking out to your workspace. This can be anywhere between a mile, 3 miles, really depends on where you're working and what the operation is for that day. To suppress wildland fires, it's really simple, hasn't changed much for 100 years, except now that we have chainsaws. It's really about removing the dead, downed, burnable fuel on the ground and to create a fuel break to get down to that bare mineral soil, making it so the fire has nothing left to burn once it gets to control lines, fire lines. This is often done with a hand crew. Folks will come in first with chainsaws to remove the big brush, shrubs, down logs, and that will be followed by folks with hand tools. So Pulaskis, shovels, lots of different types of specialized equipment, and they're digging down into that bare mineral soil, creating that fuel break with no more burnable fuel left. So in that first photo, you saw all those down logs. Here's what we did was we had the use of heavy equipment as well. They put in a big dozer line, but we were out there moving all of those big, heavy logs out, creating that space where there's a lot more open area and really taking off those ladder fuels as well. So anything that has the opportunity to bring fire up from the ground and then up into the canopies of the trees is really the work of what a lot of firefighters do to prep and to create those fuel breaks. Oftentimes you'll hear the term fighting fire with fire. That's done through a firing operation. So this is done in a coordinated fashion. You have to have favorable weather conditions. Folks will have drip torches with a diesel gasoline mixture, and they'll be putting fire onto the landscape. And so this is done so that you're burning all of that available material between the fuel break that you've created and the main fire itself. Firefighters will also often be walking up and down that fuel break line, that fire line, making sure that fire doesn't cross over into what's known as the green side, so you don't have it kind of restarting and spreading further. After the fire has come through, crews, firefighters will engage in mop up. So this is getting rid of all of that, any burning, smoldering material, anything that has the potential to reignite a fire, anything that has the potential to take an ember from wind and then move it over across your fire line and into that green. So much of my work is focused on exposure to smoke, and what we know about exposure to smoke is that it's a complex mixture of a lot of different chemicals. So this can include volatile organic compounds, polycyclic aromatic hydrocarbons, nitric oxide, particulate matter, especially within those smaller size fractions, carbon monoxide, and carbon dioxide. What we know about the health effects from the research that's been previously completed for wildland firefighters, much of it is really looking at either individual seasons or individual shifts. Many have looked at respiratory outcomes, including decreases in lung function, increases in upper respiratory symptom scores, increases in inflammation and oxidative stress. Those long-term health effects we don't know much about. With that, we have some studies that have been done. The first out of the University of Montana was looking at the years of wildland firefighting associated with different self-reported health outcomes. They found that there was associations with the increase of years of wildland firefighting associated with hypertension and heart arrhythmia. Colleagues of mine and myself at the U.S. Forest Service, we did a quantitative risk assessment that was published in 2019. And this was the first time where we were actually able to estimate risk of lung cancer and cardiovascular disease. So we did that by using a published exposure response curve and calculated dose of PM from smoke using fireline data, so data that we collected on PM4, and then paired that with heart rate data to get breathing rate to then able to calculate dose, and found that firefighters can be kind of at the lowest conservative range of a 5-year career and a 500-hour overtime season. And overtime hours are what we often use to determine how busy we were that season. So a 500-hour overtime season, 5-year career, equated to an excess risk of lung cancer of 8%, an excess risk of cardiovascular disease by 16%, and then all the way to a 1,000-hour overtime season, a 25-year career, there was an excess risk of lung cancer of 43% and an excess risk of cardiovascular disease of 30%. Kenny will go into this much more, but I just wanted to point out, IARC did reevaluate firefighting as a human carcinogen and did find that there was enough evidence to reclassify as a group 1, but really wanted to focus in on that strong mechanistic evidence that was provided to reclassify it. And much of those studies came from wildland firefighters with that chronic inflammation and oxidative stress. And then just kind of trying to figure out, what are our firefighters concerned about? What are people concerned with that may increase their risk of developing any adverse health outcomes related to their occupation? I did a survey in 2022 fire season and got about 600 participants and found that, folks are concerned about respiratory health, musculoskeletal health, every gear, all the gear that they wear every single day, that's around, between 30, 45 pounds. You're often carrying additional fuel for the chainsaw, you're carrying the chainsaw, or you may be carrying a 5-gallon cube of water. So all of that heavy material on your back, walking on uneven terrain, steep slopes. Folks are also concerned about mental health, hearing loss, cardiovascular disease, and cancer. So what we have going on right now within the federal agencies, there's been some significant legislation that has passed in the past few years that have really provided us as an anchor point and a direction to go in. And so with that, first, there was the bipartisan infrastructure law, which directed both the Secretaries of Interior and Agriculture to develop and adhere to recommendations for mitigation strategies for wildland firefighters to exposure due to line of duty environmental hazards. Secondly, it goes back to that concern around mental health that you saw in the survey results, was to establish programs for permanent, temporary, seasonal, and year-round firefighters to recognize and address mental health needs, including PTSD care. Then in the FY23 National Defense Authorization Act, it has a section called the Fairness for Federal Firefighters, which included presumptive illness coverage for many different types of cancer, as well as 24-hour post-incident cardiac arrest and stroke, and also provides direction for the Forest Service and Department of the Interior to conduct a comprehensive long-term health study in consultation with NIOSH and the Department of Labor. And for those to study firefighters who can get this coverage and are exposed to fire, smoke, and toxic fumes. It also has we have to make recommendations for legislative action to prevent these exposures. And then with partnerships, that's the theme of the day. I just wanted to highlight as well, we have a new evaluation process that we will be rolling out this spring. And this is for folks who are looking to get access to federal firefighters as participants in research projects. We want to be very careful as we move forward, as this area has a lot of interest. We want to make sure and assess projects that they are in alignment with our research priorities, that to the extent possible, projects will be reduced and prevent disruption of fire operations. I've done a lot of exposure assessment out on wildfires. You have to be very creative. And we also want to reduce duplication of research efforts. So projects will be evaluated, and then the projects that are approved will be connected with points of contacts and possible participants. These applications will be open twice per year, kind of pre-fire season and post-fire season in the spring and fall, and we'll be finalizing this process within the next month and have that out. So I just wanted to leave you all with some of the lessons learned that I've had through my time doing this work. And what I struggle with as a researcher in this field too is it's an incredibly dynamic environment. Every single day is different. Every fire is different. The weather can change your exposure. You can have a wind shift like this photo here. I could see my crewmates and then the wind shifted and they were covered in smoke. It can be dependent on the fuels and the fire behavior, and all of this really makes it difficult to do a lot of traditional exposure assessment methods when our variability is so vast. There's a real lack of knowledge on long-term health risks. We have quite a bit of data on, the exposures out there and the hazards related to smoke, but we don't know much about other ones such as thermal exposures. Right now, there's no occupational exposure limit for smoke. So when trying to put in mitigation strategies and working towards kind of a more health protective threshold, we really have nothing to compare against. But there are some mitigation and exposure reduction recommendations out there, but we haven't been able to evaluate how well these work, which ones are working best. And I think that's what's really hard is there's no right answer. It's going to be very situationally dependent. It's going to be very operationally dependent, depending on what folks' tactics are for the day and what their mission is. And so really trying to arm folks with better information to make those risk-based decisions each and every day. and also really trying to understand cumulative exposures and stressors in this environment. You know, folks are out for 14-day assignments, working 16-hour shifts all throughout the fire season. What are these cumulative exposures and the fatigue and the mental health impacts kind of all playing together, and really trying to understand comprehensive health? So thank you.
Thank you, Kat, for sharing that important information and those impactful images with us to sort of set the stage for our discussion of wildland firefighting today. Next, we'll hear from Kenny Fent to learn more about the National Firefighter Registry for Cancer. Kenny?
Thank you. Yes, so I'm going to be talking about the National Firefighter Registry for Cancer and how that applies to wildland firefighters. So this is an exposure pathway diagram for structural firefighters, and it really illustrates how complex the exposure pathways can be. So it's not just what firefighters may inhale if they're not wearing respiratory protection, but also the contaminants that get onto their protective clothing or penetrate the protective clothing and get onto their skin. Or transfer from the protective clothing or other contaminated items onto their skin, and then could be absorbed into their body through dermal exposure. There's also the potential for ingestion exposure if they have contaminated hands, depending on hand hygiene. And then contaminated clothing and other items can also off-gas, and then that presents an inhalation exposure for firefighters. And then, of course, there's also the potential for take-home exposure. So a lot of the exposures can extend even beyond the fire scene for structural firefighters. Now, what about wildland firefighters? So wildland firefighters can be exposed to many of the same chemicals that structural firefighters can be exposed to. It really depends on what's burning. And we know that a lot of wildfires are encroaching on urban areas and involving man-made materials, in which case it's going to be a lot of the same combustion byproducts. But even if we're only talking about vegetation, just like we heard from Kat, there are a lot of carcinogens that are produced in those vegetation type fires. Kat mentioned this already, but wildland firefighters, they wear lighter protective clothing than structural firefighters. They wear minimal respiratory protection, if any respiratory protection. They're in smoky environments for much longer durations, often weeks at a time, performing arduous duties. They often get soot on their skin. I think you probably saw in some of the photos that Kat shared. Soot-covered faces. They're handling a lot of contaminated items, materials, brush, other things that transfers to the skin. And then because they're in remote locations, they have limited access to water, and so it makes it hard to wash up, to wash their skin, to launder their turnout gear or get new gear. And so that presents challenges in controlling their exposures. In terms of the types of exposures that firefighters of all types can have, night shift work, sleep disruption, or poor quality sleep, UV radiation simply from being outdoor workers, diesel exhaust or other types of exhaust, products of combustion, other materials that are released during fires that aren't products of combustion. So that would include silica and heavy metals and other materials that are just released during different types of fires. And then the contaminants that are present in ash and soil, then that can be disrupted and aerosolized just from working and digging lines. And Kat mentioned the International Agency for Research on Cancer, or IARC. That's really the world's governing body that looks at different classes of compounds and classifies them as to their carcinogenicity. And so when we look at these different categories of exposure, you'll notice that many of them are known or probable carcinogens. So night shift work is considered a probable carcinogen. UV radiation and diesel exhaust are known carcinogens. And then, products of combustion that includes multiple known carcinogens. And that's true also for other materials that are released in contaminants in ash and soil. Kat mentioned this, but IARC also will evaluate occupations for carcinogenicity, and they actually met a few years ago to consider the occupation of firefighting and classified it as a group 1 known human carcinogen, and this was based on sufficient evidence for mesothelioma and bladder cancer in firefighters. They also found limited evidence for 5 other types of cancer: colon, prostate, testicular, melanoma, and non-Hodgkin lymphoma in firefighters. What is interesting is that this committee did not distinguish between structural and wildland firefighters, and that was primarily because there wasn't sufficient evidence to distinguish between wildland and structural firefighters, and wildland firefighters are likely exposed to many of the same compounds. So it's really because there is limited data to really do a comparison between structural and wildland that they were all grouped together in this classification. While IARC puts to rest the question about whether firefighting can increase firefighters' risk of cancer, there are still many questions that remain. We still do not fully understand how cancer risk has changed over time, and we know that the fuel has changed a lot over time, and certainly for wildland firefighters, these fires are encroaching on urban areas more frequently, which changes that mixture of exposures. We also don't understand the cancer risk for all the subspecialties of the fire service, and of course that includes wildland firefighters. We don't understand how cancer risk varies by demographic groups, and that would include women and minorities, how it varies regionally across the United States, how prevalent rare forms of cancer are among firefighters, and to really be able to study rare forms of cancer, you need a very large population that you can follow over time. How the cancer risk, this one's important, but how the cancer risk changes with increasing exposures, including cumulative exposures, and also major events. And we know wildland firefighters are involved in major long-lasting events, and it's a very dynamic environment, just as Kat had mentioned. We're also interested in better understanding how control interventions and other measures to reduce exposures may be reducing the risk of cancer, and then what other occupational or non-occupational factors may contribute to firefighters' risk of cancer. So the NFR for cancer was created through an act of legislation to address those knowledge gaps. And our mission is to generate detailed knowledge about cancer in the fire service through a voluntary registry that reflects our nation's diverse firefighters, and then to take that knowledge and to give it back to the fire service and public health communities so that they can take measures to hopefully reduce firefighters' risk of cancer. The components of the NFR are to collect self-reported information about firefighters and their work through a secure web portal, to obtain records from fire departments or agencies to track trends and patterns of exposure, to link with health information databases, including state cancer registries, and then to make de-identified data available for external researchers. So it's important to note that cancer is a reportable illness in all 50 states. So if you ever are diagnosed with cancer, your cancer will be reported to the state, usually the state health department in which you live. However, states do not collect detailed information about occupation. Some states do collect usual occupation, but even that is actually kind of hit or miss, because it really depends on what is in your medical record and whether your doctor is asking about your occupation. And so as a result, oftentimes researchers don't know whether what your occupation was if you're diagnosed with cancer. So in the graphic here, you have occupational exposures and the puzzle piece on the left, you have cancer outcomes and the puzzle piece on the right. And really the missing piece of the puzzle is information about the firefighter. And so the NFR for cancer allows someone to register and provide information about themselves and their work so that if they ever develop cancer, even 30 years down the road, we're able to link their information with their cancer outcomes and better understand the relationship between firefighting and cancer. And when we do that for firefighters across the country, we can learn a lot more about firefighters' risk of cancer. So in terms of who is eligible, the NFR is open to all firefighters. And it's really important that everybody understands you do not have to have cancer to register. Firefighters without cancer are just as important to register because we need to understand why some firefighters develop cancer and others do not. And then we're especially interested in enrolling firefighters who have been underrepresented in research. And of course, that includes wildland firefighters. It also includes women and minorities and volunteer firefighters. The process to enroll is very straightforward. Any firefighter, past or present in this country, can go to the secure web portal, nfr.cdc.gov, confirm their eligibility, create an account, read and sign the consent form, and fill out a user profile. And those first 5 steps can legitimately be done in about 5 minutes. And so we're telling people get started in just 5 minutes. The longer part of this is the questionnaire. We ask a lot of questions about work history, and that's really important because we need to understand what firefighters have done, how long they've been a firefighter, what types of fires did they attend. And so that does take a bit longer. But once you start the process, you can always log out and pick up where you left off. Participants will be receiving an NFR participant number after they complete consent. And that's really useful in case we want to link to other data sources down the road. So I often get the question, is the NFR really intended for wildland firefighters? And the answer to that question is 100%. So we knew when we started this that we wanted to include wildland firefighters. And so we reached out to representatives of the wildfire community to get their help in developing the enrollment process, and in particular, designing the questionnaire so that it can work for structural and wildland firefighters, which was not easy, but for example, we include wildland specific job titles and drop-down menus, and that includes hand crew, engine crew, smoke jumper, crew boss, et cetera, allowing participants to estimate the numbers of wildland fires that they attend, and that includes prescribed burns or WUI fires, and then also listing major events, and that would include wildfires that are unique in duration or intensity. In the photo here, this is actually a photo from the Maui wildfires, Lahaina wildfire, and just illustrates how unique these wildfires can be. And you can imagine the firefighters that were caught in the middle of that likely experienced a very unique and large exposure. And it's important that we're capturing that. The other piece of this is that we have a 30+ year follow-up, and that's really important for wildland firefighters because they tend to be younger, there tends to be more turnover, and so we need to be able to capture health outcomes over a long period of time for wildland firefighters. The last thing I want to say is, we've got to get the word out. We have over 10,000 firefighters that have signed up, and that's growing. That's a great start. Our goal over the next few years is to build this to 100,000 firefighters. And so we have developed a comprehensive communications campaign that includes videos, including videos of wildfire representatives, brochures, fact sheets, palm cards, posters, including wildland firefighters, And those are all available on our website. And we appreciate all our partners in helping us to get the word out. Thank you for your attention.
Thank you, Kenny, for that very informative overview of the NFR. Next, we will hear from Rick Swan, who has a very long and illustrious career as a firefighter to draw from to tell us about wildland, structural, and urban fires.
Thank you. Good morning, folks. And welcome again to this webinar on understanding the issues of structural firefighters and the differences between structural firefighters, wildland firefighters, and then these urban interface fires that we're starting to see more and more of. As you know, through the introductions of myself and all the others, all this means is I've been around for a while and I've seen some things and been able to do some things and have some great experiences. And hopefully we'll be able to impart some of that information along this morning. What I want to do now is I want to bring a kind of a foundational start to this stuff, because some people may not understand exactly what's going on, and especially in many parts of the states where PPE is a luxury and not necessarily required in many ways. But structural and wildland firefighting PPE designed and built for specific tasks. The structural PPE is designed to protect from high thermal heat and that liquid intrusion and the perspiration that comes that moves back and forth out of the firefighter. And among other things, they're used for that short time period, a short duration of time during that structural fire, which we understand maybe a couple hours at most, but much different and much less time than the wildland. The wildland PPE is designed to protect from radiant heat, and it's created that's created by the fire. And the clothing is worn for long periods of time in hot situations and in the environment. And as Kat, you notice with Kat's pictures, many times that same clothing is used day after day after day. And so there's an element of contamination, an element of the clothing in and of themselves causing some heat issues. So this has set up some issues now facing firefighters and fire departments across the United States. And that the NFPA, every 5 years, they set out and do a needs assessment. And it clearly stated that 87% of the fire departments are responsible for wildland and urban interface firefighting within the United States. Over 87%. So that's a lot of the United States that are facing these urban interface fires. The problem with this is that they say 78% of them don't train all of their firefighters on urban interface and wildland firefighting operations. And unfortunately, not all those departments and all those firefighters have the proper PPE in order to protect themselves from each of these different kinds of environments that these firefighters are facing. There's a solution to that, and it's just called the prioritization. So the point between the urban interface and the definition of wildland urban interface has really been all over the map, and it sometimes changes weekly depending on who you're talking with. But it is basically that line or area or zone where structures and other human development meet, as in a straight line, or intermingle with undeveloped wildland or vegetative areas. About 90% of the land population of the land mass in the United States faces some sort of this type of environment one way or the other, and it is only becoming more and more because there's only so many places that we can build. This is a classic example of these urban interface fires. The picture on the left is a firefighter on the deck of a fire. This wildland fire is moving up at them, and they are actively engaged in trying to knock the fire down. This is something typical that we see on almost all wildland fires. The other fire on the right is a fire out of a suburb of Dallas, Texas. Not someplace you'd necessarily think you would have urban interface fires, but as you can clearly see, the fire started on the highway and moved in and ran into those homes. This was a 10-acre fire. It destroyed 9 homes, damaging 17 others. And these are the types of fires that our communities are facing today. Not just the large conflagrations that tend to grab all the headlines, but these are the fires that we are seeing more and more, and that our firefighters and fire departments are facing more and more. The issue with this, it is very difficult to determine the true amount of urban interface fires due to poor reporting processes. That issue is going to be taken care of and being handled here very soon. And they're having a new fire reporting system that will allow for better urban interface fire reporting. We have to be able to match the information that we're getting from the efforts that our firefighters are putting up with, and the actual numbers, because that's where we're going to start getting the responses from governments, from local governments, from federal governments and state governments, in order to help and protect our fire departments and our firefighters on dealing with these fires. And remember, 87% of the fire departments that responded to these needs assessments are responsible for these urban interface areas, and they respond to these types of fires. So it's not just, what you would think of as Southern California anymore. I want to highlight something here, and this is what you see probably across many areas of the United States, particularly in the South and East. We have this is the typical interface mix of homes and vegetation, driveways, roadways, in and out, going through. We see this all over the United States, and particularly I said in the East. And you're noticing more and more of these as we start becoming a little bit more rural, and the suburbs tend to start moving further and further into the rural areas. These are the types of fires. These are the types of areas that we're moving into. I want you to take a notice of that yellow circle on the left-hand side of the picture there. That's a swimming pool, and it's going to come into a picture here next, and to kind of give you a reference point on how we can look at and how things come forward with these types of incidents. This is a satellite image of the same fire, of the Gatlinburg fire that happened December 2016. All of the blue little squares that you see there are were homes. This fire ran up through this subdivision, and that yellow circle is that same yellow circle from the picture before of that pool that you noticed, that was all the nice clean vegetation, all the nice homes that were lined up and looking really good. But this is the outcome of that urban interface fire that ran through, and you can get a good stark picture of what can in a before and after type of shot. It's very important that we understand these things, because in the long run, we are all going to have to face the component of dealing with an urban interface and an urban interface issue. So this is the Camp Fire from 2018. This fire started on November 8th, 2018 in a Northern California community out of Butte County. The fire originated above several communities and was driven by an east wind downhill through these developed areas. The Camp Fire resulted in 85 civilian deaths, 12 civilian injuries, and 5 firefighters were injured. It destroyed over 18,000 homes. Most of this destruction occurred within the first 4 hours. That's an important component here. This fire, unfortunately for the firefighters in this fire, they did very little firefighting because they had to get the people out of the way. This was a community up on a hillside with basically one way in, one way out, and these firefighters were moving people out of this area as fast as they could, trying to move on. Now, the interesting piece of this photo is that this picture was taken at 10 a.m. on the first day of the fire. There is no sun. And why is there no sun? Because there's smoke that is obliterating the sunlight. It is an important factor here that, as both Kat and Kenny were describing to you, that this smoke, while it is not a campfire, as the name of the fire is, it's not a fire that you would have at a campground. This is a large-scale urban interface fire that's producing tons and tons of toxic smoke. And we don't know all the stuff that is out of it and what it's going on in and how it is working to protect our wildland firefighters. As Kat had said in her presentation, these are just a small sampling of the chemical lists that are found in both structure fires and wildland fires. The only difference here in this situation is that structural firefighters have a protective self-contained breathing apparatus providing clean air for firefighters. Wildland firefighters, they have a hard time with breathing apparatus. A structure fire, a urban interface fire, you have to be agile and mobile in order to work and go from house to house, move around and in between some of the from place to place. And that just doesn't work. So a wildland firefighter or those structural firefighters that are responding to more and more wildland and urban interface fires, we have been using for forever a very technical piece of apparatus called a bandana. And that's the protection that wildland firefighters basically use. Basically, it protects about 12% of the particulate that's going through when you see an N95 would be protecting 95%. So we have some problems with this. And one of the great things that we notice and we're moving forward now is that, there's almost a half a century of really good research and structure and for the needs of structural firefighters. But we're just now coming up to about maybe 20 years worth of good work for urban and wildland interface firefighters. As you may have noticed from Kat's information, a lot of her stuff, which has proven golden to our efforts to protect wildland firefighters and the respiratory protection issues, it's just really been in the last maybe 5, maybe at most 10 years that we've really gotten some good information. And so we're looking forward to more and more of this information and looking forward to more and more of how this can protect our wildland firefighters and our structural firefighters that are responding more and more to wildland fires. And in order to have that protection and in order to have that information, it's going to require a lot of work. And one of the things that we want to we're kind of hammering on again is the National Firefighter Registry for Cancer. I'm not going to go through all the pieces of this, but one of the things that I do want to remind folks about is that I retired almost 12 years ago now from the fire service. This is really important for those retired firefighters that are out there that have information and can provide their input and their data for the registry. Remember, we don't know, we don't have a very good idea of the urban interface fires that are out there because the data system is not there. And so we are working on that. Now we are working on that data system of getting information on cancers so that we can protect more and more of our firefighters and promote the presumptive protections that firefighters need. It's simple. And as Kenny said, it doesn't take much, but we need your data. And with that, I thank you.
Thank you, Rick, for those very moving images and also for sharing the information that you've amassed over your long career as a firefighter, a practicing firefighter, and also a firefighter educator. Now we will hear about the personal protective equipment side of things from Jay Tarley. Jay?
Good morning. Thank you all for attending. My name is Jay Tarley. I'm with the MPPTO post-market PPE testing team. Today I will cover how the National Personal Protective Technology Laboratory strives to collaborate with the 4 groups you see there on the right: standards groups, government, users, industry, and labor. I would like to start off by talking about NIOSH's NPPTL's commitment to equitable PPE for all workers, where we are developing a national strategy for equitable PPE protections for all United States workers. Equitable PPE protections is a multifaceted construct requiring collaboration from within larger community of organizations and individuals who use or facilitate the use of PPE. Partnerships are instrumental part of this strategy, where we are implementing the 4 components you see on the right: the Federal Register notice, meetings, and the workshop, which expanded beyond our traditional partnerships and are core to the roadmap that is under development now. We had a workshop in November of 2022, which had over 1,000 people who attended, and over 70 of the attendees expressed interest in continued collaborations. NPPTL's research standards and approval activities protect the nation's first responders, including 1 million firefighters. And that is where I'm focusing today, and how we can collaborate on new projects protecting wildland firefighters. This slide shows the collaborations we are currently have on structural PPE ensemble. I can envision us having similar collaborations on wildland PPE in the near future. The first is one with NIST, which assesses the impact of laundering, and NIOSH develops its own test methods and also uses test methods developed by NIST to determine how well your gear is being cleaned. We look at the concentration of chemical changes after being washed. We also look at how the concentration of chemicals used to make the gear itself changes with launderings. This one is with the University of Cincinnati to evaluate next generation garment. And we are working with the University of Cincinnati to support the development and testing of a prototype garment that integrates passive and active cooling technology. We are currently working with our partner to determine if this type of cooling technology can decrease the physiological demand on your bodies while also still allowing you to move and perform life-saving tasks. The next one is with Northeastern State University to improve gloves for flashover events. And we are working with Northern State University or Northeastern State University to approve glove protections. We're using computational modeling to determine whether a special kind of material known as phase change material can be used to increase the amount of time before burns to the hands occur when there is a flashover event. And NIOSH approves respirators for use in workplace settings, including your SCBA, that offers protections from chemical, biological, radiological, and nuclear threats, better known as CBRN threats. We worked with the DHS and Department of Defense to make sure your APRs continue to protect you against constantly evolving CBRN threats and determine which hazards are most appropriate for SCBAs. DOT tests SCBAs against chemical warfare agents. We also work to coordinate with the Safety Equipment Institute, who performs additional tests to NFPA standards and after an SCBA receives NIOSH approval. Finally, when there is a line of duty death, we test and evaluate the SCBA and make sure it is properly functioning. NIOSH approves respirators for the use of, we are conducting studies to evaluate thermal protection exposure with the Illinois Fire Service Institute. Collaborating with the Illinois Fire Service Institute, NIOSH has conducted many laboratory and live burn studies to determine how effective the ensemble is at preventing dermal exposure to burn hazards. We've taken a careful look at the glove coat interface and the hood coat helmet interface as well to determine what might reach your skin, and then to determine how much of the hazard on your skin is being absorbed into your body. Additionally, NIOSH is currently determining whether chemicals used in the construction of the gear itself are being liberated during firefighting activities and then making contact with the skin and entering the body. And next, we are developing and evaluating turnout gear retirement criteria. In this project, we are working with a large number of industry partners, including gear manufacturers, fire departments, independent service providers, standard developed organizations, and universities. 2 partners are currently engaging with us extensively, and that's the International Public Safety Data Institute and the City of Columbus Fire Department. We are collecting hundreds of turnout gear, coats, and pants from 3 different fire departments, where we can also make estimates about how the gear was being used or its life. We are then testing and evaluating that gear to see how the level of protection that it provides changes in response to how it was used. We will also use this information to make recommendations about retirement. And I'd like to go back and talk about the cooling garment. The material in that cooling garment with the University of Cincinnati is a non-woven fabric made of carbon nanotubes. The CNT fabric has special properties in that heat will only cross this non-woven CNT fabric in one direction. Therefore, when we're in it properly, the heat generated by the body will transfer from the body through the fabric to the outside environment, but the heat coming from the outside environment will not transfer across the fabric or in the opposite direction to the body. The body will be shielded from heat in this manner and will not gain heat from the environment. In addition, the fabric is layered such that a battery-driven fan can blow ice-cooled air through the layer between the 2 pieces of fabric to effectively create a thermal gradient between the body and the fabric to increase the cooling effect. And we work with IFF and NFPA in our continued collaborations and communications. One of the most successful and ongoing partnerships have been with the Fire Protection Research Foundation on what is called the How Clean is Clean project. We worked in collaboration with internal personal protection and gear cleaning solutions and received funding from FEMA through the Fire Protection Research Foundation. The Fire Protection Research Foundation is the research division of NFPA. NFPA has stated that this project has been the most effective project they have had with regards to changing the standards. It has had a ripple effect on nearly all the standards surrounding firefighter PPE, health and safety. It has changed the entire industry from manufacturing to the cleaning process and administrative requirements. I was the chair of the 1977 committee, and I'm still participating on this committee as a principal. There have been many issues over the years regarding firefighter PPE and sizing. During my tenure as chair, we were able to bring new designs and parameters to the committee through the work of task groups and needed additions to the groups. The standard is currently attempting to address these issues by adopting different sizing charts and parameters. There is a need for continued research on PPE for wildland firefighters regarding sizing, materials, multi-purpose stationwear, PFAS and PPE, and particulate blocking materials. This activity is also part of our equitable PPE protections effort. I'd like to talk about a potential partnership with 1977. There is a mandatory testing performed regularly on the fire shelter and testing that is used when evaluating new materials and designs. These tests are identified by Forest Service specifications and another Forest Service created documentation. The design and testing has been created and carried out solely by the Forest Service in the past in collaborations with organizations in Canada. Other governmental organizations could work with the Forest Service to possibly support them in this activity. During my time as chair of 1977, we were able to agree to bring this Forest Service spec into the 77 standard. We were also able to agree on the standard being a minimum, which would allow for manufacturers to build a more robust shelter. But then the test apparatus was stolen. There isn't a place currently in the US to test these shelters, which presents an area for collaboration. From this slide, I would like to point out the 2 ways of contamination from wildfires and wildland urban interface events, which Kat and Kenny both touched on. Contaminants can be emitted from the fire or formed in the atmosphere around the fire, and both are deposited on the gear. Some of the adverse health effects from wildland smoke include asthma and some probable carcinogens from PAHs. We have worked with the Missoula Firefighter Center to identify contaminants on wildland PPE. We came up with the idea of building a passive decontamination box due to the wildland firefighters being in the field for extended times. The National Wildfire Coordinating Group provides national leadership to enable interoperable wildland fire operations among federal, state, local, tribal, and territorial partners. It reminds me of the NFPA, but it's just for wildland firefighters. They have committees that establish things like standards and qualification requirements. I'm currently on the Equipment Technology Committee and the Fire Shelter and Personal Protective Equipment Subcommittee. Working with these committees are examples that show the continued need for collaboration, not only on the committee level, but opportunities to be involved possibly on the executive level. This would afford all involved to complete our concerted mission, which falls in line with the title of this webinar, expanding our research partnerships and protecting wildland firefighter safety and health. Thank you.
Thank you, Jay. This has been such a fantastic and informative set of presentations. And on behalf of NIOSH, I would like to extend a very warm thank you to all of our speakers for sharing such important insights into firefighter safety and health with us today. This concludes the presentation portion of today's webinar.